Opening credits. First Aid, the essential guide to the fundamentals of emergency care. Written by Wesley Jones. Narrated by Rick Parody. Introduction. The necessity of first aid training. What is first aid? Usually first aid is used to treat small injuries. Very rarely it is a matter of life and death. First aid can be used anywhere when there is an injury, be it at home, school, workplace, and in public places. Basically, first aid is the prompt provision of essential emergency care to injured or sick persons. Sometimes first aid care is all that is required for people who have sustained minor injuries and illness and no further medical assistance is needed. In serious situations, the prompt first aid attendance to anyone who is injured before an ambulance can get to the scene makes the difference between life and death, or a full or partial recovery. The purpose of first aid: save life, prevent further injuries or harm, prevent injuries from becoming worse, provide relief from pain, and to reassure the injured person. For example, some of the things that you will learn are: Number 1. How to stop the tongue from blocking the airway when someone is having a seizure. Number 2. No matter what first aid training you get, you will be taught the ABCs of first aid. These are airway, breathing, and circulation. This means that during emergency situations you will have to focus on the airways to make sure that they are not blocked. For example, choking on food can block the airways. Then you have to ensure that the person is breathing correctly. Then, for people whose hearts have stopped, you will be taught how to create an artificial circulation in the body. First aid training is a very useful skill to have, even if you are not in a health service profession. You never know when you will need the skills to be able to help someone important to you. There are many organizations that provide first aid training. However, to ensure that you get training from a legitimate organization, you should make sure they are licensed to provide you with the training. There are different courses which you can choose from when you want to get some first aid training. These courses are based on different levels according to difficulty. Level 1 training includes many emergency medical modules. The course mostly contains theoretical modules, as well as the practical skills that are needed to apply first aid. There are usually 3 courses in total. A lot of first aid training schools offer students the option of taking a single course that is a combination of material from the 3 different levels. The material from these courses will include learner manuals, simulated situations, audiovisual aids, and practical activities. The most important thing that you will learn in any first aid course is the ability to assist injured people with emergency life support in any situation. Some of the things that you will learn are: getting in touch with emergency service personnel, CPR, how to help someone when they are choking, safety, treating fractures and burns, how to stop bleeding. For some professionals, it is very important to have first aid training, and these include the teachers and police personnel. But some people undertake first aid training in order to progress further in the field, with a view to enter a particular profession, such as ambulance assisting. Also, if you have a babysitter taking care of your children all day, it is recommended that you pay for them to receive first aid training. You want them to be able to react and respond appropriately in emergency situations, where one of your children could be injured. First aid training is an invaluable training to undertake, and it is not very expensive. Significance of first aid training. Emergency situations always arise unexpectedly. Whether it is a minor accident or a serious one, first aid training will give you the confidence to act immediately. Acquiring first aid skills can enable you to help victims who are injured or who fall ill at the workplace, at home, or on the road until medical help arrives. First aid training can thus help you act on time to save lives. A study shows that more than 2 million people in the United States are hospitalized every year because of injuries, and more than 100,000 of them die. You could make a huge difference by learning how to provide effective first aid during an emergency. The purpose of giving first aid. The goals of administering first aid include preserving the life of the victim, preventing or minimizing further injury, helping the victim speed up recovery from injury or illness, protecting the unconscious, ensuring the casualty receives proper medical help. First aid minutes could make a difference. If the oxygen is cut off, the brain will die in the next 6 minutes. A victim bleeding for as little as 5 minutes may die. Bones that are not set at the right time may not hold weight. Cuts that are not cleaned immediately can become seriously infected. In first aid, minutes could make a difference. Knowing what to do under emergency situation can help you save lives. First aid training helps you take necessary action as quickly as possible, which in turn helps reduce the severity of injury or illness. Your knowledge and expertise in first aid could make a difference between life and death and temporary and permanent disability. If the injury is severe, the victim may become unconscious. If you are trained in first aid, you know how to treat the injury quickly to ensure that the person is stable. Always be prepared for emergency situations. Taking first aid training is the only way you will learn how to respond to the situation quickly and confidently. In order to give proper first aid, you must be well prepared. Always carry with you a personal first aid kit. An emergency situation can occur at any time. You can keep the kit within easy reach in your car, at home, or at the office. Ensure that the first aid kit is equipped with proper supplies like gauze pads and bandages. Keep emergency phone numbers like the Poison Control Center, Emergency Medical Service, and the ambulance. Take your first aid kit with you when you go camping and boating. It is not advisable to give medications like aspirin, especially if the victim is bleeding. Chapter 1. Basic first aid you should know. The name tells all in this case. Basic first aid that you should know is what needs to be done first. When you consider the topic of first aid, it is important to understand that its true nature is really very basic. Although people who have received first aid training and professionals such as emergency medical technicians will view basic first aid as the first treatment given for just about any injury regardless of how minor, it really is concerned with only 3 life-saving situations. These 3 areas are stopping bleeding, restore breathing, and prevent shock. These are the 3 life-threatening conditions. When you discuss a first aid treatment, such as splinting a broken arm, it could be argued that if you are not sure exactly what to do, you can simply wait for help. Although having knowledge of splinting techniques is useful information, the victim's life is not threatened by the broken arm. If a person is bleeding, or not breathing, or going into shock, you cannot just wait. Action must be taken immediately. This is why everyone should understand the basic first aid involved in these conditions. Bleeding must be stopped. The loss of too much blood will lead to death. First aid for bleeding involves putting pressure on the wound. It is a very simple technique, but absolutely essential. The application of a tourniquet is a bit more complex issue. Most first aid manuals will tell you never to use a tourniquet, but will usually add a big except to it. The exception might be a severed limb. But there are still always exceptions. The principle is stopping bleeding. Failure to do so will result in death. Breathing is another essential life function. If breathing stops, death follows. Basic first aid techniques for the restoration of breathing include the Heimlich maneuver and CPR. The Heimlich maneuver is a method of dislodging a blockage in the throat that is causing choking. It is easy to learn and fairly simple to do, but can be life-saving. CPR is a bit more difficult. In most cases, a person must be trained and licensed to perform it. It is for this reason some do not consider it basic first aid. But if breathing is not restored, death will result. Shock is called the hidden killer. It is the body's reaction to trauma. There are symptoms that give a clue that a body is going into shock, but often they are unclear or mistaken for something else. It is always safe to assume that shock will result from any injury. The treatments for shock are simple and very basic. Keeping the patient warm and covered and rising the feet are examples of the basic first aid for shock. There are many other areas that could be called basic first aid, and they are good to know. First aid training of any kind is valuable. It is the life-saving techniques that are the real basic first aid that you should know. However, because they are for those situations when you cannot afford to wait for help. The essentials in a first aid kit. You just never know when an emergency might arise, and no matter how minor or major the injury or illness is, you should be prepared with a first aid kit that is stocked correctly. By making sure that all the essentials in a first aid kit can be found in your kit, you'll be much better prepared to handle most any emergency. There are all kinds of first aid kits, and what yours should have really does depend on the activity, your location, whether it's your home kit or your travel kit, and your first aid training. When your first aid kit is properly stocked, you should be able to respond much faster. Here is a list of essentials in a first aid kit. Analgesic, pain reliever. Aspirin or ibuprofen have anti-inflammatory qualities, so these NSAIDs are better from the perspective. However, acetaminophen or Tylenol are easier on the stomach, and both classes of medication deal with pain. Antibiotic ointment. Neosporin or polysporin are just a couple of antibiotic ointments that are applied topically to reduce the risk of infection. Antacid. Zantac or Alka-Seltzer are available over the counter. Make sure you throw a bottle of Tums in your first aid kit too. Antihistamine are used to reduce allergy symptoms. They stop allergy symptoms like watery eyes, itching, and runny nose. Decongestant will help clear a stuffy nose and improve breathing. Hydrocortisone cream relieves the itching, redness, dryness, inflammation, and discomfort of various skin conditions. Antiseptic, such as hydrogen peroxide, are necessary for cleaning and disinfecting wounds. Besides bottled hydrogen peroxide, you should have individual packets of alcohol wipes. Instant cold packs, used to reduce swelling, easily activated for emergency use when cold therapy is required. Bandages. You need a full supply of adhesive bandages, elastic bandages with safety pins, moleskin, and gauze pads and adhesive tape. Thermometer. The in-the-ear style thermometer are affordable and easy to use. Space blanket. These handy little blankets can make a big difference in cases of shock or hypothermia. Eye wash. You need to have eye wash solution and eye drops. Splints. Carry a few different sizes. Accessories. Latex gloves, scissors, tweezers, and mouthpiece all need to be part of your first aid kit. An emergency can arise at any given moment, and you need to be prepared. By having a well-stocked emergency kit, you'll be ready. As well as the essential in a first aid kit, you might consider taking a basic first aid course so that you are really prepared. If there is bleeding, it needs to be stopped. Lose too much blood and a person will die. You need to know where to put pressure on the wound to stop the bleeding. Breathing is also essential to life. If breathing stops, then death will follow. So you need to know how to do the Heimlich maneuver and CPR. What should a restaurant's first aid kit include? Every restaurant should have at least one first aid kit on the premises. It has to be prepared for any eventuality, whether it involves a kitchen staff member or a customer. Be sure that you select a team of staff to train as health and safety officers. In the case of an emergency, there has to be someone on the premises that knows what to do while waiting for the ambulance to arrive. As a restaurant owner, you have to ensure that the first aid kit includes all the essential health and safety items to deal with various types of restaurant-related accidents. Plus, first aid kits need to comply with health and safety standards. This is what a well-stocked restaurant first aid kit should contain. Triangular bandage, sterile swabs to clean open wounds, non-sterile swabs to clean other wounds, Mandy splint, safety pins, first aid scissor, Resp Aid CPR mouthpiece, plasters, Dermaplast adhesive plasters, Dermatape paper, Anit allergy plaster, 4 pairs of gloves, forceps to remove or lift objects, FAD large stretch number 5, FAD medium stretch number 3, cotton wool for cleaning of the wounds, Centramide solution 100 milliliter, stretch bandages of various sizes, blue plasters used for X-ray purposes, burn pack to treat burn wounds, first aid booklet for reference purposes. When acquiring a first aid kit, look for a bag that is made of an easy-to-clean material and that has a reflective cross on the front. The material should be strong and durable enough to hold all the contents. It would be ideal if the bag has a clear PVC window for a quick view of the contents. This is advantageous during an emergency when you have to act fast. When it is not in use, you should store it in a visible area that is easily accessible, such as on a passage wall. Thus, the bag should have a hook and loop for easy hanging and storage. There are a lot of items that are required for a complete restaurant first aid kit. Furthermore, ensure that you have sufficient quantities of each item and that the individual items are usable for life. Chapter 2: Basic First Aid Guidelines for Tending to Wounds. The term wound in medical terminology means a break in the skin or mucous membranes of the body. This is called an open wound. It can also refer to internal injuries, even when there is no external cut or break. This is called a closed wound. Wounds are also classified by the type of damage that has taken place. So first, it is helpful to understand these basic types of wounds in order to be able to offer further first aid treatment. We will discuss open wounds, how to evaluate what kind is present, and how to treat them. Here is a concise introduction to the types of open wounds that might occur. Number 1. Abrasion is basically a scrape or scratch in which the outer surface of the skin is injured, but without considerable bleeding. A typical example is the scraping of a knee upon a fall on the sidewalk or the rubbing of the skin against a hard surface. Number 2. Incision is a cut on the skin that appears straight and direct as in a knife wound or glass cut. There are clean edges that might not be very long, but depending on the depth of the incision, this could result in excessive bleeding. Number 3. Avulsion is the term used when a part of the body has been forcibly torn away, such as in a gunshot wound, animal bite, or car accident. Heavy blood loss is usually always the result of an avulsion. Number 4. Puncture. This type of damage is caused by a sharp object that pierces through the skin, creating a hole of varying depths. This type of injury tends to cover a small area, and that does not bleed intensively. Number 5. Laceration is caused by a rough or blunt item that leaves a cut with irregular edges. Bleeding can be heavy and serious. Emergency first aid for how to properly dress a wound. Here are some fabulous emergency first aid tips in case you are ever in a car accident or need to do some emergency first aid on someone who is bleeding. Just follow these 3 tips to properly treat a wound and give first aid in an emergency. Emergency first aid. 3 do's and do nots. Number 1. Apply direct pressure to the wound, and do not remove the pressure to check if the bleeding is stopped. No looking. A big mistake that people often commit is to remove the cloth that is applying pressure to the wound, and then the wound just reopens and starts to bleed again. Number 2. Find the pressure point, because if you push there, the bleeding will stop completely. Also, elevate the wound, if it is on an arm, for example, because if you raise it up, the person's heart won't be able to pump as much blood up to the wound. You want to make sure not to apply pressure above the wound, which is a common mistake. The best way to get the bleeding to stop is to apply direct pressure on the wound itself. Number 3. Use a clean dressing, like a clean clothing, for example, but not bare hands, which are dirty, particularly if any of the person's insides are coming out. If you have a clean shirt or rag, that will work well. Otherwise, if you are at home, you can use a clean bedsheet or towel even. How a first aid guide can help you. You need to pay heed to simple tips that every good first aid guide will give you, including understanding how necessary it is to cleanse your hands thoroughly before and after you treat an injured person. The first aid guide will also show you how to give basic first aid care, including calling 911 for obtaining medical assistance, keeping the victim in a lying down position, and applying direct pressure through use of a sterile dressing or clean cloth directly where the wounded area is. Also, a good first aid guide will tell you to never remove objects from the wound and only let a doctor to do the removal. Another area where a guide comes in handy is when it has to do with learning about cleaning as well as bandaging wounds. Thus, you will need to wash up your hands and to also cleanse up the area that has been injured and then remember to blot it dry. In addition, you will need to use antibiotic ointment on the wounds even if they are minor, and to cover the larger wounds with gauze or use a bandage. In fact, it can also show you what to do when treating injuries to the eyes, and in case something gets impaled into the wounded person's eyes, you need to first of all call up 911, and then remember to never try removing the object on your own. Next, you will need to cover the eyes, both, with sterilizing dressings, as this will help minimize any movement of the injured eyes. Another use is also especially useful in providing tips on how to handle burns, including first-degree and second-degree, as well as third-degree burns. In case of first-degree burns, there is usually only reddened as well as swollen skin, and this won't really require any kind of attention. While in the case of second-degree burns, you may need to provide small amount of attention. Third-degree burns are serious, with some amount of charring noticeable on the skin, and then it needs to be medically treated promptly as the injured person will be in considerable pain, which requires attention. You should also possess a first aid manual, as it can help you learn things such as not forgetting that you are aiding a human being and thus understand that you need to act with compassion and provide reassurance to the injured person, as well as perhaps distract their attention from their condition. A good first aid guide can also show you the actual steps that you need to take to treat the person under different conditions. That includes treating poison cases and also infants who are in need of aid. What is the first aid treatment for wounds? The following is the first aid treatment for externally bleeding wounds. Do not apply a tourniquet unless trained to do so. Do not push anything back into the skin. Do not apply antibiotic cream unless the wound is minor and cleaned first. Do not remove blood-soaked bandages. Do not put pressure on an object sticking out of the wound. Do not use pressure points nor elevation. The following is the first aid treatment for major wounds. Call for medical help. Apply continuous, firm, direct pressure to the wound, using clean cloth or bandage until the bleeding stops. If bleeding soaks through the bandage, do not remove the original bandage. Apply more bandages and pressure. Get medical help to cleanse and close the wound. Monitor and treat for shock if present. The following is the first aid treatment for minimally bleeding wounds. Clean the wound with soap and clean running tap water. Apply continuous, firm, direct pressure to the wound until bleeding stops. Once the bleeding stops, apply antibiotic ointment. Cover it with a dressing. If bleeding soaks through the bandage, do not remove the original bandage. Apply more bandages and pressure. Chapter 3. Cleaning shared needles? The most effective way to avoid contamination with injection drug use is to use a new, sterile needle every time. But there are some harm reduction strategies, like cleaning needles, that may decrease the likelihood of contamination. It's critical to mention, however, that cleaning needles is not 100% effective at eliminating the risk of transmission. And, though your question conveys concern over the risk to your boyfriend's health, if you and your boyfriend have a sexual relationship, your health may be at risk as well. If clean needles are not available, attempting to disinfect used needles appears to be better than simply reusing contaminated ones. To that end, it is good that your boyfriend is already using bleach, as recent studies have shown that undiluted, not watered-down bleach is the most effective disinfectant for reducing HIV, HBV, and HCV in contaminated syringes. In fact, it can kill HIV in 30 seconds, but thorough after-bleach treatment is recommended. The Alliance Health Project, link is external, at the University of California, San Francisco, suggests using these steps to disinfect syringes when there's not a better option. Fill the used syringe with clean water. Shake up the water-filled syringe. Squirt the water out. Repeat steps 1 to 3 until you no longer see blood in the syringe. Fill the entire syringe with undiluted bleach and leave it in there for 30 seconds or more. Try humming the Happy Birthday to You song all the way through 3 times over. Squirt all the bleach out. Fill the syringe with clean water again, shake it up, and squirt the water out. Repeat this step a few times to avoid injecting bleach into the body. While bleach may be the recommended disinfectant, it may dull the point of the needles and break down the rubber in the syringes over time. Other household disinfectants may also be used, such as hydrogen peroxide, ethanol, and isopropanol, but they require multiple rinses before they are able to disinfect as effectively as bleach. Cleaning needles may lower your boyfriend's risk of contamination, but it won't eliminate the risk. Both HIV and HCV can survive on surfaces for up to 4 weeks, so it's recommended that users only inject themselves, set up a clean surface, avoid detachable needles, and wash their hands before and after injecting to avoid further contamination. Using new needles every time is the most effective method for minimizing contamination. If it's difficult for your boyfriend to get new syringes, try seeing if there is a needle exchange program near you. Organizations such as the North American Syringe Exchange Network, link is external, can help you locate a center or program nearby. Lastly, you don't mention whether you're worried about your partner's drug use in general. just that you're concerned about his shared use of needles. In addition to sharing this information about cleaning needles, it could be a good idea for you both to also talk about how his injection drug use affects you both. Sharing syringes for injection drug use increases the risk for a number of infections, not just for him, but it could potentially have implications for your own physical and emotional health as his partner too. Consider whether it makes sense for you both to talk with a healthcare provider about the risk for blood-borne infections, preventive care such as getting hepatitis B vaccine, and getting tested for sexually transmitted infections, STIs. If you aren't already, you might also use barrier methods of contraception, such as condoms, during sex to help further reduce your own risk. Blisters treatment. Number 1. For a blister that has not popped, try not to pop or drain it. Leave it uncovered or cover loosely with a bandage. Try not to put pressure on the area. If the blister is in a pressure area such as the bottom of the foot, put a donut-shaped moleskin around it. Number 2. For a blister that has popped, wash the area with warm water and gentle soap. Do not use alcohol, hydrogen peroxide, or iodine. Smooth down the skin flap that remains, apply antibiotic ointment to the area, and cover the area loosely with a sterile bandage or gauze. Number 3. When to drain a blister. To drain a blister that is large, painful, or in an awkward spot, wash the area. Sterilize a needle with rubbing alcohol and water. Make a small hole at the edge of the blister. Gently squeeze out the fluid. Wash the blister again and pat dry. Don't remove the skin over the blister. Smooth down the skin flap. Apply antibiotic ointment. Cover the area loosely with a sterile bandage or gauze. Number 4. Follow up. Change the bandage daily and whenever it gets dirty or wet. Avoid wearing shoes or doing the activity that caused the blister until it heals. Wear thick socks or work gloves for blisters on the feet or hands. See a doctor for signs of infection, including pus, fever, red or warm skin around the blister, red streaks leading away from the blister, swollen lymph glands, or increased pain or swelling, or if your last tetanus shot was more than 10 years ago. Emergencies and first aid. Direct pressure to stop bleeding. Number 1. Elevate the wound above the heart and apply firm pressure with a clean compress, such as a clean, heavy gauze pad, washcloth, t-shirt, or sock, directly on the wound. Call out for someone to get help or call 911 yourself. Do not remove a pad that is soaked through with blood. You will disturb any blood clots that have started to form to help stop the bleeding. If blood soaks through, place another pad on top of the soaked one and continue applying direct pressure. Number 2. When the bleeding slows or stops, tie the pad firmly in place with gauze strips, a necktie, strips of sheet, or a shoelace. Do not tie so tightly that blood flow to the rest of the limb is cut off. Stay with the person and keep the wound elevated until medical help arrives. Pressure points for severe bleeding. If severe bleeding does not stop with direct pressure and elevation, apply direct pressure to an artery. Use direct pressure on an artery along with elevation and direct pressure on the wound. There are specific major arteries in the body where pressure should be placed. When you apply pressure to an artery, you stop bleeding by pushing the artery against bone. Press down firmly on the artery between the bleeding site and the heart. If there is severe bleeding, also apply firm pressure directly to the bleeding site. To check if bleeding has been stopped, release your finger slowly from the pressure point, but do not release pressure at the bleeding site. If bleeding continues, continue to apply pressure to the artery. Continue until the bleeding stops or until help arrives. After bleeding stops, do not continue to apply pressure to an artery for longer than 5 minutes. Emergencies and first aid. Mouth-to-mouth resuscitation. Mouth-to-mouth resuscitation. Mouth-to-mouth and mouth-to-nose resuscitation on a child under age 8 or an infant. Place the child on a hard, flat surface. Look into the mouth and throat to ensure that the airway is clear. If an object is present, try to sweep it out with your fingers. If unsuccessful and the object is blocking the airway, apply the Heimlich maneuver. If vomiting occurs, turn the child onto his or her side and sweep out the mouth with 2 fingers. Tilt the head back slightly to open the airway. Place your mouth tightly over the nose and mouth. Blow 2 quick, shallow breaths, smaller breaths than you would give to an adult. Watch for the chest to rise. Remove your mouth. Look for the chest to fall as the child exhales. Listen for the sounds of breathing. Feel for the child's breath on your cheek. If breathing does not start on its own, repeat the procedure. Mouth-to-mouth resuscitation on a child age 8 or older or on an adult. Number 1. Make sure the person is lying on a hard, flat surface. Look into the mouth and throat to ensure that the airway is clear. If an object is present, try to sweep it out with your fingers. Wear disposable surgical gloves if they are available. Apply the Heimlich maneuver if unsuccessful and the object is blocking the airway. If vomiting occurs, turn the person on his or her side and sweep out the mouth with 2 fingers. Do not place your finger in the mouth if the person is rigid or is having a seizure. Number 2. Tilt the head back slightly to open the airway. Put upward pressure on the jaw to pull it forward. Number 3. Pinch the nostrils closed with thumb and index finger. Place your mouth tightly over the person's mouth. Use a mouthpiece if one is available. Blow 2 quick breaths and watch for the person's chest to rise. Number 4. Release the nostrils. Look for the person's chest to fall as he or she exhales. Listen for the sound of breathing. Feel for the person's breath on your cheek. If the person does not start breathing on his or her own, repeat the procedure. Burn wound progression and the importance of first aid. Burn injuries are often seen as a challenge to clinicians due to their complexity. Healing is dependent on the quality of the initial management of the wound. Best practice involves cooling the wound with water for 20 minutes within 3 hours of the initial injury, and yet this is not widely known. This simple action can prevent the wound from increasing in size and can offer a better psychological, social, physical, and functional outcome for the patient. National educational strategies and awareness campaigns to promote a standardized approach to first aid for burns and scalds are needed. This article looks at what happens to the burn wound following injury and discusses the importance of timely and appropriate first aid. Chapter 4. Burns. First aid for burns. To distinguish a minor burn from a serious burn, the first step is to determine the degree and the extent of damage to body tissues. The 3 classifications of first-degree burn, second-degree burn, and third-degree burn will help you determine emergency care. First-degree burn. The least serious burns are those in which only the outer layer of skin, epidermis, is burned. The skin is usually red, with swelling and pain sometimes present. The outer layers of skin hasn't been burned through. Treat a first-degree burn as a minor burn unless it involves substantial portions of the hands, feet, face, groin, or buttocks, or a major joint. Second-degree burn. When the first layer of skin has been burned through and the second layer of skin, dermis, also is burned, the injury is termed a second-degree burn. Blisters develop and the skin takes on an intensely reddened, splotchy appearance. Second-degree burns produce severe pain and swelling. For minor burns, including second-degree burns, limited to an area no larger than 2 to 3 inches in diameter, take the following action. Cool the burn. Hold the burned area under cool running water for at least 10 minutes or until the pain subsides. If this is impractical, immerse the burn in cool water or cool it with cool compresses. Cooling the burn reduces swelling by conducting heat away from the skin. Don't put ice on the burn. Cover the burn with a sterile gauze, preferably non-adhesive. Don't use fluffy cotton, which may irritate and stick to the skin. Wrap the dressing loosely to avoid putting pressure on burned skin. Take an over-the-counter pain reliever. These include paracetamol, ibuprofen. Never give aspirin to children or teenagers. Minor burns usually heal without further treatment. They may heal with pigment changes, meaning the healed area may be a different color from the surrounding skin. Watch for signs of infection, such as increased pain, redness, fever, swelling, or oozing. If infection develops, seek medical help. Avoid re-injuring or tanning if the burns are less than a year old. Doing so may cause more extensive pigmentation changes. Use sunscreen on the area for at least a year. Caution: don't use ice. Putting ice directly on a burn can cause frostbite, further damaging your skin. Don't break blisters. Broken blisters are vulnerable to infection. Third-degree burn. The most serious burns are painless and involve all layers of the skin. Fat, muscle, and even bone may be affected. Areas may be charred black and appear dry and white. Difficulty inhaling and exhaling, carbon monoxide poisoning, and other toxic effects may occur if smoke inhalation accompanies the burn. First aid for emergency situations. When an emergency strikes, there's no time to start researching how to respond. For your own safety and the safety of your friends and family, it's a good idea to learn about emergency protocol and first aid methods. By learning in advance, you'll ensure that you can respond quickly and appropriately if there's ever an emergency situation. From natural disasters to traffic accidents, you never know when a situation will arise that will demand quick thinking, cool nerves, and a little bit of know-how. Be prepared for an emergency. The first step you can take towards emergency preparedness is education. Take time to learn about the most common emergency situations that could affect you and your loved ones. Research which types of natural disasters are most likely to affect your community, whether it's hurricanes, floods, or tornadoes. Consider, too, which extra risk factors may particularly affect you and your family. For example, if you have small children and you live near a body of water, you should make sure you understand what to do in case of drowning. Types of emergencies. While each person runs into slightly different risks, depending on lifestyle and geography, many of the most common emergency situations can happen to anyone. Health-related emergencies, such as sudden heart attacks or strokes, can affect a surprisingly wide cross-section of the population. Automobile accidents are an extremely common cause of injury. Whether an accident results in minor whiplash or more serious injuries, it's important to learn how to respond quickly. Many emergency situations involve threatening situations with other people. It's worth learning what to do in case of muggings, home burglaries, and other scenarios where your personal safety may be endangered. Injury prevention. Naturally, taking preventative steps to avoid injury is far better than trying to mend the problem afterwards. In many cases, a few common sense practices can go a long way. Follow the same simple safety rules you were taught as a child, and teach them to any children you might have as well. For example, every child learns to look both ways before crossing the road, but many grow up to be inveterate jaywalkers as adults. When driving, abstain from imbibing any alcohol. Instead, use a designated driver system or plan to take a taxi when appropriate. Finally, learn to trust your gut. If you're walking down a dark street in a shady part of town and you begin to question your safety, follow your instinct and find a better means of getting wherever you need to go. Emergency action steps. In emergency situations, it is important to respond quickly. A clear emergency action plan is a good way to streamline your responses. If you break down your plan into steps, you'll be sure to know exactly what to do. For example, your family might draw up an emergency action plan in case of a house fire. First, each family member would find the safest route out of the house. Next, everyone would gather at a certain point, a good distance from the house. First aid. In many emergency cases, the best thing you can do is stay calm and collected. Heightened emotions tend to hamper your critical thinking skills and your ability to think quickly. In addition to staying cool under pressure, several concrete skills can make the difference in life and death situations. For example, any adult and even older children should be able to apply pressure to a wound, administer CPR, check for signs of obstructed breathing, and perform a few other basic measures. Just knowing what to do is often the hardest part. In addition, though, it's a good idea to put together a first aid kit, so you'll have any item you need on hand. Depending on the circumstances, the kit may include bandages, clean water, an antiseptic, and other critical supplies. A first aid kit for your car might include a blanket, while a home first aid kit might include more medical supplies. Chapter 5. Having the right first aid supplies. It's getting that time again to go camping. Always make sure you carry a first aid kit with you that is well stocked with a variety of things like bandages and gauze of different sizes, tweezers, scissors, sterile wipes, and rinse solutions, antiseptic creams, pain medicine, splint materials, a chemical ice pack, and anti-diarrhea medicine, sunscreen, and insect repellent. The most common injuries on a camping trip are strains and sprains. Next are lacerations, puncture wounds, burns, blisters, and emulsions. We're playing in the great outdoors now, so you'll have to expect accidents, so come prepared. When you're out gathering firewood for the campfire or unloading the camping equipment, most likely you'll get a splinter, or a cut or scrape. That's when the tweezers, antibiotic cream, and bandages will come in handy. If you slip or fall, you may twist your ankle, so be sure you have a splint, gauze, and plenty of pain medicine. It's a good idea to take a good water filtration system with you, or you may just need that anti-diarrhea medicine. Be sure that you periodically restock your first aid kit and replace any old medicine that may be outdated. Another item you should consider packing with your gear is a snake bite kit. You never know when you might stumble across one of these varmints unexpectedly, and he's having a bad day. First aid supplies for all situations. There are basic first aid supplies, and then there are supplies relevant to situations and environments. The basic kit might include elastic bandages, eye pads, sterile sponges, bandages, tweezers, scissors, ointments, band-aids, disinfectant, aspirin, a first aid instruction booklet, and first aid for bee stings. Inhalants, burn and pain treatments should also be included. Hydrogen peroxide is an invaluable product to have in your kit. Different situations might include trips to areas where there are contagions or diseases not common to your home territory. Traveling companions who are at risk might need special items packed in their kits to ward off catastrophe. Blood pressure kits and treatments for diabetes and other known ailments should be included in the basic kits. For those traveling to frigid climates, different items might be needed. Emergency space blankets, waterproof matches, candles, and a fire starter might be included in the kit. For hunters traveling to remote areas, whistles, compasses, sewing kits, water purification tablets, or the new containers that purify water might be included. Fishing kits, flashlights, splints, and communication devices might be needed. A knife and small axe should be included. If someone breaks a leg or is traumatized, these items could be used to make a splint, stretcher, or travois. When survival depends upon the items that are contained within your kit, it needs to be complete. Traveling to areas where temperatures are high and heat can be a life-threatening factor requires certain precautions. Extra water and water containers should be packed. Insect repellents, snake bite kits, and instructions on ways to salvage water and moisture from the environment should be included. Ice packs could be packed for emergency situations. Compasses and a GPS could be used with great effectiveness. A booklet on small game trapping techniques could be a lifesaver. Traveling to new environments requires extra precaution. If a trip to Africa is on your agenda, plans must be initiated to handle all situations that might be encountered in that country. Inoculations and shots are sometimes mandated for trips to the areas of your choice. Sleeping sickness and concentrations of tsetse flies call for the inclusion of appropriate medical supplies in your kit. Clothing should also be a part of your first aid plans. Inappropriate clothing can lead to extreme medical problems. Clothes that breathe and good headgear that protect your body from the sun are invaluable. A small poncho or some type of rainwear can also protect your body from serious problems. First aid kits are available in many different sizes. They are offered in basic packages that reflect the level of protection. The larger and more expensive units offer products that can cover many medical situations. Whether you are at home or on an exotic trip to a foreign land, first aid kits are invaluable. The kits can save lives. They can prolong life until experienced medical care can become available. An ounce of prevention is worth a pound of cure. 4 types of situations where immediate first aid is required. Here are various accidents and emergency situations that require the administration of first aid. This immediate aid can keep your health stable until medical help arrives. A layperson who has no knowledge of first aid will often not know what to do in such a situation. Only a trained individual will be confident enough to perform the necessary treatment procedures and then wait till an ambulance gets there. To make this world safer, it would help if most people in general would know when first aid should be given and what procedures must be followed. Here are 4 main situations that require immediate first aid for starters. Choking. There are times you may choke on food and it blocks your airway. This will obstruct your breathing. If you are far from a hospital, you will need immediate help to calm you and then remove the foreign body from your airway. Fractured and broken bones. Road traffic accidents can lead to broken hands and legs. Before you can be moved to a hospital, you need emergency treatment at the scene. Depending on your health condition, you will require certain procedures to control the bleeding and stabilize your bones. Slings and splints are made out of readily available material and used to support the broken bones. Cuts and wounds. Cuts and wounds can result in minimal to heavy bleeding that must be immediately controlled. Superficial wounds will need to be cleaned and then bandaged to prevent infection. Once the bleeding is under control, stitching may be required for deep wounds. Burns. Burns can be of varying degrees, and the treatment is dependent on the degree of the burn. Dressing the burn wound will reduce your pain until further treatment can be provided by professional medical persons. For severe burns, if you are unsure, it is better to do nothing except wait for the paramedics to arrive. These are a few of the main situations that need immediate first aid administration. It could be a long time before you can be taken to your healthcare center. In such cases, first aid keeps you alive until you can receive professional medical attention. Proper treatment can also prevent further complications. If you require a trained person to treat you when you are in an accident, you also must learn first aid to help others in similar situations. Chapter 6. First Aid Bandages, Plasters, and Wound Dressings. The important thing is to stay as compact as your needs might be, so that your first aid kit does not become unwieldy. Number 1. Plasters in assorted sizes. For those small cuts and grazes, it is best to have these individually packed for sterility. Waterproof plasters offer the greatest versatility for all sports and weather conditions. No real brand preferences here. Number 2. Crepe bandage. This comes tightly rolled and packed in its own plastic wrapping. I prefer the cotton crepe pre-stretched bandage that is 5 centimeters wide for most purposes. A well-known brand to most of you sporting types out there. The usual crinkly crepe bandage is too elastic to support sprains and strains well, although it is good for holding wound dressings in place if you have space for a small roll. So the best bet is 1 roll of each. Number 3. Triangular bandage. This simple cotton bandage can be used to support a sprained shoulder, bind on a wound dressing, or help to splint more seriously injured parts. It packs flat and is very useful. Number 4. Wound dressings. If your sport or activity exposes you to the risk of an abrasion, where the top layer of your skin is abraded off, for example in a fall on rough ground, you may want to have some small dressing items too. These might form a separate little kit in its own plastic bag, comprising a small bottle of antiseptic solution for washing the wound, a paraffin waxed gauze to cover the wound so that other dressings don't stick to the surface, making it a tearful experience removing them later, some sterile cotton gauze pads, and tape or plaster to hold it all in place. These items can all be bought in single packaged form in local pharmacies. Number 5. More serious wound dressings. If you feel that you might have to handle a little bit more than just simple scrapes, for example road rash from a bike fall, 2 other items may be useful. The first is 1 inch, 2.5 centimeter athletic tape. This is used to strap injured joints, etc., and is very versatile for other purposes ranging from holding bandages in place to taping up the departing sole on your sports shoe to affixing your power gels onto your bike top tube. This is the medical equivalent of 90-mile-per-hour tape, and the other item is small suture strips. These are used in place of having stitches put in when a deep cut can be dried and needs to be closed until you see a doctor. First aid medicine and medication. The medications that you carry in your first aid kit can be readily purchased from any pharmacy without a prescription. Just be sure to carry the instructions along with you reminding you how to use the medication that you pack. And whenever possible, pack the medication in those small plastic bags that lock up, as in the well-known Ziploc bags. You know, the ones you get your medicine in when you see a doctor. Number 1. Pain, including headache. Generic name: mefenemic acid. Trade name: Ponstan. 2 capsules taken up to 4 times a day, 6 hours apart, until there is pain relief. For those with gastric problems, take antacids first, or take the Ponstan after some food. Number 2. Fever. Generic name: paracetamol. Trade name: Panadol. 2 times 500 milligram tablets or capsules every 6 hours until the fever stays down. Panadol also helps to relieve mild pain, such as headaches. Number 3. Running nose. Generic name: chlorpheniramine. Trade name: Piriton. 1 tablet up to 3 times a day. This makes you drowsy, so don't take this if you need to stay alert and awake. A side note to this is that it also helps you to sleep when you are having problems doing that. Non-sedating medicine is also available. Number 4. Gastric upset. Antacid tablets, activated charcoal. Take 2 activated charcoal tablets. They look awful and black, but are tasteless. If there is stomach pain felt as a burning ache often called heartburn, take 2 antacid tablets. Number 5. Diarrhea. Generic name: loperamide. Trade name: Lomotil, Imodium. I personally find that Imodium capsules work more effectively for a quick stop to those watery events. 2 capsules taken immediately, and 1 capsule up to 3 times a day until the diarrhea stops. Number 6. Itchy rash, insect bites. Hydrocortisone cream. Just apply a little and rub it into the affected area of your skin. Reapply after bathing. Just a little goes a long way. Other useful first aid items. I have found that a few other items come in really handy in a ready-to-go first aid kit. Number 1. Small pocket tool. The smallest of the Swiss Army pocket knife range. Barely 7 centimeters long, very thin, and yet it has a blade for cutting, shaving, bursting blisters, etc. Small scissors, tweezers, splinter removal, and a nail file, of course. Number 2. Safety pins. Useful for clothing repairs to bandage adjustment to fastening competition number tags. Don't leave home without some. Number 3. Small torch light. Again, I have a favorite. The one that is made by Energizer, the battery makers, that has a clip on one end and a very bright white light on the other end of a twistable stalk. This allows the light to be clipped onto something, so you don't need to hold it while you work with it. Great for reading too, and nocturnal loo activities. Enough said. Number 4. Individually packed alcohol swabs. These are little sachet-packed items that can be used to clean needles or blades that you are going to use to burst those blisters, as well as wounds. Ouch, but very effective. How to create the ultimate sports first aid kit. Most sports people and regular travelers carry some form of first aid kit with them. This usually comprises favorite illness or injury treatment items, and may even be one of the conveniently available commercial first aid kits. I believe that you can get more value and use out of it just in case, because you never know when you might need it. Standby first aid kit if you prepare this yourself. And here are some guidelines to get you started in building your very own sports first aid kit. There are 2 essential considerations for your personal first aid kit: what you think you may need to treat, and what you feel you are capable of using to provide your own self-treatment. In addition to this, needs differ according to your activity. The needs of the weekend warrior soccer player are going to be different from the adventure racer who travels overseas to take part in wild terrain competitions. So let's take a common ground approach and set up a sports first aid kit that allows you to take care of bothersome minor illnesses, headaches, diarrhea, etc., as well as little cuts, grazes, or sprains that may not need the attention of a doctor. And let's make sure that it is all packed in a small, convenient container to make it packing friendly. I've divided your sports first aid kit contents into 3 categories: bandages, plasters, and wound dressings, medicine and medication, and other useful items. Conclusion. First aid plays a crucial part of the health and safety program of any organization. Imagine what could happen if someone at work stopped breathing or starts bleeding from a wound all of a sudden. If you have sufficient knowledge in first aid and have necessary first aid supplies on hand, you can save their lives, reduce the extent of damage, and help prevent future problems. Further action would require dressing the wound, which is taught more effectively through a first aid training course. It is highly recommended for any individuals who want to be prepared for possible emergency situation that involves tending to the treatment of minor but most severe wounds that you get proper medical training. People who know first aid techniques can often save a life or prevent further pain and damage to the victim. The end.